Desert Healthcare District and Foundation presents a podcast that supports your health and wellness where you live. This is Healthy Desert, Healthy You, hosted by Will Dean. Now, here's Will.
Hello, friends. Thank you for tuning in for another episode of Healthy Desert, Healthy You. We're doing something a little different today. I have two guests, and we're going to be talking about the Desert Healthcare District and Foundation's new strategic plan. For those of you who have heard the podcast before, or you follow the district, you know you've heard about the strategic plan. It represents a really significant shift for the district. I like to call it a reimagining of what the district is and what it does. But one of our guests is going to have a much more eloquent explanation of what that is. They're actually going to be in conversation because with any major change, there are questions about what it means for the community, what it means for our nonprofit partners. So one of our guests is a nonprofit leader in the Coachella Valley. So I'm going to have them introduce themselves and then we'll get into the questions. I'm going to start with Kraig.
Will, thank you so much. Good afternoon, everyone. I'm Kraig Johnson. I'm the Executive Director for Jewish Family Service of the Desert, and it's just a pleasure to be here.
Thank you, Kraig.
I will. Thank you
Hi.
very much for having me on up there today. My name is Sophie Blondeau, and I'm a partner and the Chief Strategy Officer at Sowen, and we're a social impact consulting firm, and we've had the pleasure of working with the district over the last 10 months to create this plan. Very excited to have the opportunity to talk about it today.
Yeah, thank you, Sophie and Kraig. And I want to add for our viewers that our board actually approved the strategic plan in May of 2026. And it's actually, the implementation of it begins on July 1st of 2026. So Sophie, if you would give us that elevator pitch, that definition of what a strategic plan is.
Absolutely. A strategic plan is basically a roadmap for an organization to enable them to achieve their highest potential. So, every organization has a vision and a mission for what they want to accomplish. And you need to have the elements that galvanize the entire organization towards one focus point. And then the second part is, well, how do you get there, right? So you need to make sure that all of the stakeholders, and that includes, the internal stakeholders. So that means the board and the staff at the district, but also the external stakeholders, like the nonprofit partners that Kraig is leading, all know what we're trying to achieve together. It also, it's very much a plan that focuses us so that we use our best capabilities to create the maximum impact. And I always like to say, a strategic planning process is somewhat difficult. It's painful because you have to say no to some things because you can't do everything, right? You only have some amount of time and resources. And so it's really about focusing and fine-tuning and committing. And then it serves as this point of reference for everyone. So we know that strategic plan is for the next 5 years. That's a long time. Lots of things can happen. A lot of things in the context change. And so it gives everybody somewhere to go back to and say, this is what we're trying to achieve together.
Right. Thank you for that, Sophie. And I want to add for the viewers that the strategic plan and all of the supporting documents, or many of the supporting documents, are on our website at dhcd.org. They are in Spanish and English so that you can go and read it for yourself, and we encourage you to do that. But I want to start with Kraig. So Kraig, I know you reviewed the plan and you have some questions. Why don't you start?
Yeah, and also I'd like to add not just the plan itself, which is the schematic, or at least when you go to the link that says plan, it's the schematic. Also, the report was very interesting that actually provided some answers to some of the questions that I had about how this actually was done. So for those out there who are going to visit the district site, please take a look at the report as well. That's also very important. It was interesting, and I think the overall question, and maybe a good one to start the conversation with Sophie, is in a nutshell, what is different about this plan compared to the previous plan, if it can be put into a nutshell?
So there's a lot of things that are, so the first part of the answer is a strategic plan should always be an evolution, right? It should not be a revolution. We are not, changing everything at the district. What we always want to do is to build on the organization's strengths, right? So there are some similarities so that we ensure continuity. That's the first thing I want to answer on that question. So the similarities are the most important part of the strategic plan is identifying the most critical needs and aligning the organization's strengths, right? So those have not changed, right? The workforce shortages has been an ongoing issue in the Valley, and access has been an ongoing issue, which is why they represent the first two pillars of this plan. So that is similar. What has been very different is that we've also made it added social determinants of health as a core pillar, because we know that access to health is influenced by many, right? Whether you can get to an appointment, access to healthy food, access to housing. So that is a really, really important difference. The second one is the data pillar, because we know that in order to measure impact, which is what we want to do, right? We don't want to just, the strategic plan until it's put into action and it is followed through with whether it is actually creating impact, it's really not that helpful, right? So we're holding ourselves accountable by putting that as a strategic pillar to say, we are going to track the data and we're going to use that data to reflect back to the community that change is happening, but also inform all of the decisions that the district and the staff make, which is really, really important. That's really important. We've also made it much more streamlined. The last plan, there were a lot of initiatives. There was a very clear distinction between goals and strategies and initiatives. And so it was very hard to act upon. So we made it much more actionable, which is the other thing that is really, really important. But really, the focus on social determinants of health and the medical impact is a data-driven approach to hold everybody accountable is really important. Now, I'll talk about it later because it's the other big piece that I'm sure you'll ask me about that too. But we're really moving the organization from just being a funding organization to becoming a health system amplifier.
Yeah.
And that means that we are aiming to really take, the most potential, which is that the district is known as a great strategic partner. I think you might have even been one of the people that we interviewed early on that said, yeah, we like working with them. They're a good strategic thinker. We can collaborate. I think we were also one of the participants in our meeting session where everybody said, yeah, we want to know more about this work. We want to participate in this work. And so this is what the opportunity is here, right? Is to really amplify all of the good work that happens in the Coachella Valley and not just spot effort by effort. So really look at it as a system-wide effort.
Yeah. In a read through it too, and just a brief comparison to the previous strategic plan, it seemed to me that the newly adopted plan allows for a bit more creativity, partnering, creativity. It was less focused on specific types of medicine and medical care and healthcare and more about even the future, about establishing a foundation for more growth and success in the future. Which again, I think you kind of touched on it earlier. This is a 5-year plan as opposed to a 1-year or a 3-year that allows for maybe a focus on the future. So I thought that was interesting. I was also taken by the focus on data. I know in a grant recipient and reporter to the district how much they are driven by the data. We have good partners locally, like the HARC is a good partner. So I'm curious to see how the district partners with those pros who are already doing that good work. But really, I thought it was a good job in not throwing the baby out with the bathwater. We don't have to start all over with brand new. We're not doing anything right.
Yeah.
But with a intentional look at the future, I thought it was very insightful from your part, but also very helpful then for us who then live under the strategic plan for the next 5 years.
And I so appreciate that, Kraig. I mean, on a couple of notes. One, like you said, we started, first of all, it's a great endeavor for an organization to say, we're going to do a strategic plan, right? Because you have to look at yourself out and, yeah. So that's not easy. And so we are always impressed by the courage and the commitment of the board and the staff throughout this process. I can't tell you how committed everybody was. And this would not be possible if there wasn't that commitment to co-creation and looking inside.
Yeah.
And I think that it is really interesting. Two things on the data point. We will definitely work with partners, and there's two sides to the data point. One is internal. So you got to practice what you preach, right? Become a data-driven organization that makes decisions, but you see what's working, what's not working, so you can adapt. But it's also in the second, all external partners, so that all of the good data is shared out so that everyone can benefit from it and everyone can make better decisions and help each other along.
Right.
A lot of good data.
Yeah.
On the long term, second thing is that on the discovery part, it looks at the organization from many different levels. So it's not just like what you're doing right. It's like, do you have the right people in place? Have the right processes? What kind of tools are you using? You be using better tools that save money and save time, right? What's the culture? They collaborate. The health system amplifier can only exist if it's internalized and externalized, right? So within when you look at pillars, it's really to give people a snapshot of what the district is to do, but the intent is that there's going to be a lot of cross collaboration internally, right? Everyone speaking to each other, especially when it comes to selecting partners, and externally, same thing. It's like it'll be I always say ours because I feel like so like close to the team now, but it's the job of the district to identify those partners and you can, it's like, this good work is happening. This great idea just came up. How can we, bring these people together?
Yeah.
And then finally, there was a lot of emphasis, as you know, measured at AA, it's new financial sort of sustainability. So it was a core thing while we were doing this process to say, this is not just about 1, 2, 3, 5 years. It's like 30 years. Like, how do we use this new, income and ensure that it's sustainable, so that it's not just 5 years. And that's really important. And I love, the innovation. You're so excited to hear from partners about the good work the good ideas. And, a strategic plan needs to be flexible. These are just guidelines. And so I'm glad that you think that there's the potential there for collaboration and innovation. It's really important.
So, Kraig, I believe one of the questions that you had about the strategic plan pertains to a word used in the description of the first two pillars. Why don't you ask Sophie about that?
Yeah, thank you very much, Will. I noted the use of the word equitably increase the workforce, equitably increase awareness. And I guess the question was, because that word was featured prominently, was in any discussions with anyone in the community, was there a sense that services were not being offered equitably, or that we needed to focus more on the equitable distribution of services or provision of services?
Yes. So that, first of all, the focus on equity is something that is a lens that is used across the entire plan. That was the focus of many discussions amongst the board and the staff when we did our work sessions, that it should be very intentional. So I'm glad that you picked up on that. So we heard from community members, but beyond the community sessions, it was also echoed in the quantitative, health studies, that there's definitely inequities in the way people access care. So it's not so much about what care is. It is what care is available to everybody, but it's also the barriers to access. And so we need to be very intentional how we address those barriers, whether it's language, whether it's geography. We have very different communities and they have different needs. And so we talked about the LGBTQ plus community and having, care that reflects your values and your current, lived experience. And that's hard to find. It's, in terms of language, having, language barriers. So it's really addressing those barriers to access that really affect equity. And so, we are really hoping that with this plan, we will shift how people access healthcare and that we can meet them where they're starting. So it's not, so that's the intent behind that word.
Yeah, I appreciate that. And I don't know why it pops in my mind. Maybe I'm a contrarian. I get concerned, especially the district, a government entity, when we start setting up programs and services for a community. there's going to be people who fall through the cracks, who slip through the cracks. You know what I mean? And so it's because if you start that much difference between, well, blue eyes, green eyes, there, when you start making it for everyone customizable, I don't know that we're there yet. I know medicine is getting to be where it's customizable.
Yeah.
I hope there is some sort of tolerance within the community, and we will make our best effort to do whatever we can to tailor something for you. But, as service providers, as the government, we may not be able to tailor something specifically for you. We will do our best. And, let's work together and let's not finger point and call each other right. It's, we're in this together
Oh,
as
yes.
a community. So
It
good.
is absolutely. It's really, it's the effort of reaching everyone equitably, and ensuring that, some of the community sessions, I think that you attended, Kraig, it's even questions about knowing that these services are available, right?
We do know that. And that's the stigma. We know stigma is a debilitating symptom that we're never going to do without. Unfortunately, we're just human nature. But there are services available, and people do not take advantage of those services. And why is that? So we certainly have our work ahead of us as the district and as service provider. I think the good news is I get a sense in this community, and maybe you can corroborate this. There's a lot of cohesiveness in this community. We partner with about 30 different agencies, and we're just one, relatively small. So I get the sense of that we're better together. Did you get a sense of that in your work, Sophie?
Absolutely. I got that from the beginning to the end. So, we were new to the Coachella Valley, and we always want to make sure that we get to know our partners as much as we can. So we had those very preliminary, conversations with people like yourselves, just to say, hey, tell us about your work. Tell us about what you're seeing in this community, So, and the conversations we had were so welcoming and so informative. And that started really the whole entire process, right? Because we then, through surveys, we got that sense. Through the community sessions, we got that sense. And then what was really beautiful was in the community sessions, how everybody started collaborating in the room, right? They were like, hey, wait, I have this service, or I have this study, or I've tried this, and I want to, I am happy to share. So 1,000%, it is very fertile ground for this system amplifier to really blossom. Really, really fertile ground.
Yeah, and I'm glad that you saw that as well. And we're very fortunate. Well, this is not, to kiss up the district. I mean, we are so very fortunate to have the district because the district does serve as a partner. The district is not saying, and not by anyone I've ever heard, Will, that, they're just the bank. I've never heard anyone say that. It's always been working with this district, partnering with the district. Well, that's the district, what they think. They're the experts, the district. So really, we're very fortunate, and I hope that people you spoke with, Sophie, recognize that. I know we do, Will, and all the agencies with whom we partner are very, and I love working with the district, with you and your colleagues, Will, but that we're fortunate, I think, for many different reasons. And so I think we have a very strong opportunity to make the goals of the strategic plan come to fruition. But really, Sophie, we want to thank you and your colleagues for the work and putting it together. I'm curious, was there anything that you heard that way? Maybe we shouldn't announce it here on the podcast, but was there anything that you heard was like, oh my gosh, that's troubling. That's a little scary. We need to report that. We need help with that. And maybe I shouldn't know, but
no, I mean, I thought about that question, because I heard the question ahead of time, and I was like, there were no problems. I mean, there were I'll tell you the one thing that is problematic is that the district does so much good work and that not enough people are aware of it. That is a problem. That because I think that the partners that work with the team have a very, very similar sense that you have. They're good partners. They listen. They're open to innovation, which is critical. They're open to change. Like this plan is a perfect example of their willingness to evolve. And again, people like to stay the same. Change is hard. So when you have a team and a board that's committed to evolving and in growing, you're in good company. But I do feel like the public itself doesn't know enough about the great work that the district does. And I really hope that will be something that we focus on. And being data driven and being aware of the impact that we're making, that's going to be a big job for Will. No, I'm kidding, Will, to say, hey, this is where we started and this is the progress we're making. Right. This goes back to the equity piece, Kraig. It's basically ensuring that everybody has access and that we can measure progress so that we can reflect back to the community, say there was a lapse or there was a gap here and we're making progress towards that gap. But yeah, we have to get the word out about the great work that the district is doing across the community.
Right. That is definitely a challenge. And I'm hopeful that this episode, the podcast and other efforts are going to help correct that.
Yes.
Really great questions. Kraig, do you have any other things that you noticed about the plan that you want to ask about?
Well, I don't know about necessarily the plan, but that comment is very interesting, Will, because you and I have the same problem where we know we do wonderful things for the community and most people, I would dare say, don't know it. So maybe, Will, we should collaborate somehow. We're going to figure out how we get the word about the district and JFS out to the community. And you remember that idea I had about the diners, drive-ins, and dives thing where we go around and interview people?
Do.
But honestly, Will, in my mind, what can we do to promote the district? Okay, we have our constant contact. We have social media. And I want to know what we can do because the district has been such an important partner with us for the years that we've been around. How can we help that? How can we help you in that? And I want to know and I want to do it. So please let me know.
I definitely appreciate that. And I will definitely let you know. I know early on that we did a lot of nonprofit spotlights. I know that JFS was part of that where we did videos and you guys really helped promote those. So I think we need to bring that back and do more of that.
Let's go.
Yeah.
Let's do it.
Absolutely.
I love that. I love that because, we know that qualitative data is just as important as quantitative. People really gravitate to stories, to the lived experience, to like that really brings it to life. Yep. I think that's so important. So important.
So there are a couple of other questions that I wanted to touch on. These are from the frequently asked questions that are on the website. So Sophie, one of them is, what is the grant budget for the fiscal year 2026, 2027?
So the approved budget, as I know it today, because, things changed, but it's $10 million. So for the fiscal year 2026, 2027. And, that is going to be a significant increase over the previous year. So that's very exciting, which makes, the importance of this plan even greater, right? We really need to be very intentional about where we focus our attention and because we have a huge fiscal responsibility. So it's exciting. And it also means that we have to be very serious and focused.
Right. Do you want to talk about the grant application period?
Yes. So as you know, we said before, implementing a new strategic plan is something that happens over time. It's not overnight. So, when you approve the strategic plan that was approved in May, it's not like the organization switches on and says, okay, we're ready to go, especially because we're asking the organization to evolve and change the way they work. Like I said, it's going to, even internally, there's going to be processes that are going to change to ensure that they really act like a health care, amplifier. So that means a lot of cross collaboration. So we are working with the staff and the board to set all the systems into place. Like I said before, we evaluated the systems and the tools and the processes at the beginning of this effort. Now we have a plan and now we are implementing the processes, the tools and the people to make sure that everybody is equipped and ready to go to make this implementation a success. So we are taking the next couple of months to do that. And I think that by, January 2027, we'll be ready to go with the fully new processes and really, really in good shape to launch this plan.
Yeah, that's really important for the grantees to know. Another question they likely have or will have is, will they face new reporting requirements under the new plan?
I don't foresee any, new things. What it will be, of course, will have to be consistent with the goals that we set for each pillar. So we're going to need to see that alignment. And we have started to work on a measurement impact scheme. And that's going to be correlated to what the reporting is required. But that is not only for the grantees, it's for the organization as well, right? So we're looking at reporting for the pillars all the way down to the initiatives. So there will be some changes, but at this point, there's, I don't think it's going to be anything drastic.
Awesome. All right. This has been a really great conversation. Thank you both for joining me today. We could go on and on about the strategic plan. There's so much information there. But I really encourage our viewers and our listeners to go to the website, dhcd.org. There is a strategic plan webpage dedicated to the plan, the report, all the supporting documents. Please check that out. This is a very exciting time for the healthcare district. I think we're about 77 years old, and I feel like this is definitely a new chapter for us.
That's right.
And the whole planning process has been very community-centric, community-focused, and we definitely want to keep that going. So if you're listening or watching out there and you have questions about the plan that you don't see answered on the website, then you can always email us at info@dhcd.org. Sophie, again, thank you. Kraig, thank you. And Kraig, I want to say to you, your kind words before, that the district really appreciates having partners like you and JFS as well.
Thank you. No, we are better together, and we can't do this in a silo and by ourselves. But we need to realize how very fortunate we are to be here in the Coachella Valley. It could be far worse. And again, with the district's leadership, we are very well positioned to have a very sparkling future related to our healthcare. Thank you.
Thank you.
Thank you so much, Will. And, I just want to say, one last thing is the way that this strategic plan came to be was really through true collaboration. And this is a perfect reflection of that process. And it will only be a success if that collaboration continues. So I'm so excited to be part of this conversation and future conversations.
All right. Thank you, Sophie. That is our show, everyone. Please be well and follow our podcast. We're available on YouTube, Spotify, Apple Music, wherever you enjoy your podcasts.
Thank you for joining us on this episode of Healthy Desert, Healthy You. This podcast is a production of the Desert Healthcare District and Foundation in Palm Springs, California. For more information, please visit the website dhcd.org. Our annual conference site is healthydesert.healthyu.com. This podcast is available at most major podcast portals, including Amazon Music, Apple Podcasts, Audible, Captivate.fm, Spotify, and YouTube Music. Thanks for listening. Be sure to subscribe.